Hi, everybody. It's Felice, and I'm back again. And I have a segment, and it is fueled with a sense of urgency because I've had many questions and many encounters over the past 2 days that really gave me a clear understanding about what this segment needs to be about. It's going to be about just how to make it through the night, how to make it to the next day. Once you found out you have diabetes or you've been having trouble managing your diabetes. So thank you for watching the channel. Please subscribe if you'd like. Also, give me a like if you'd like. And I also have my Facebook page, Felice Diabetes, Beating the Bully, and Loving Life. So hopefully, as I said before, these segments are to help you understand what's going on. So when you go to your doctor or you go to see the practitioner in your area who may be caring for you, so you have a better understand, you guys can communicate better, and you feel more comfortable with managing your diabetes. So first off, thanks for your questions, thanks for your time. But first off, I want you to stop and breathe. So you found out you have diabetes. You can make it. I have seen many people get diagnosed and feel like it's the end of the world. I've gotten comments saying, "Oh my God, how can I deal with it?" And then you are absolutely correct in feeling what you need to feel. What I want to do is let you know that there are ways for you to have a great quality of life, even if you have a diagnosis of diabetes, and even if you have other diseases that are going on. So first off, what is diabetes? Well, there's an organ in the body called the pancreas. It's a little organ that sits kind of behind, our lungs and all of that, up in that general area. And what it does is it releases a substance called insulin into the body when humans eat. So insulin, what it does is process the food that humans eat for energy. We all need energy as humans to function. So we eat food. And what food does is some food turns into sugar in the body. So what the insulin does is when it senses that we have taking in things that are making our blood sugar levels rise, because we need that for energy, the insulin knows when to come in and make sure that blood sugar doesn't go too high, that it becomes a problem. So that's how it works in the normal person or the person without diabetes. When you have diabetes, there are two kinds, and I will tell you, but when you have diabetes, for some reason your body is unable to or is having difficulty processing the foods that we put in our body that turn to sugar in our body. So as a result, that builds up and it gets higher and higher and higher. And as we say, that blood sugar level gets higher. And because the body is unable to make insulin, or it doesn't have enough in it, or the insulin that's in it is having some difficulty working, the blood sugars go up high and they can't come back down. So the body is trying to figure out what's going on. It's in a panic mode because that blood sugar's been high and it's staying high too long. So the body's trying to fix it. And in the meantime, the other things that's going on in your body that needs attention are kind of being pushed back by the wayside. And so that's how you become susceptible to other illnesses when you have a diagnosis of diabetes. So we talk about what diabetes is. Diabetes is the body's inability or ineffective way of using and processing the carbohydrates, the sugars, those things that elevate our blood sugar. With diabetes, we have a problem with being able to do that. So we need help. So what does that look like? What that looks like is, for someone like me, I am what they call a person with type 1 diabetes. They used to call it juvenile diabetes. They thought it only happened to children. They thought you were diagnosed at a young age, which I was diagnosed at 11. But basically, what type 1 diabetes is, for some reason, my pancreas broke. It stopped making insulin. And I don't know exactly when that happened, but I know I was diagnosed at 11 years old. And my pancreas just said, you know what? I'm done. So, with type 1 diabetes, your pancreas does not make insulin. We need insulin to live. Insulin is an essential component for the body to function. So if you have diabetes and you can't get insulin and you have type 1 diabetes, you can pretty much figure out what that outcome will be eventually. And that's why insulin is so important to type 1 people with diabetes. Is there a cure for diabetes? Somebody asked me that. If there is, I would have gotten it. I told them I had diabetes for 45 years. They said, oh, is there a cure? And then they thought about it and apologized. As far as I know, there is not a cure. But for people with type 1, we got to get our insulin from other places. So that could be injections from insulin from a vial. Because I've had diabetes so long, I've taken insulin every which way but loose. So you can do an injection with insulin from a vial, which is still a very common practice, because that is an alternative for people who, and I'll talk about that when you have issues paying for your insulin. Anyway, you can get it from a vial. You can use the insulin pen if the doctor prescribed that for you, or you can use an insulin pump, which is a piece of equipment that you wear on your body and and it gives you insulin all the time. Or you can try inhalable insulin. Wonderful insulin, very difficult to get. Works so well, very difficult to get. So, and they're always, the field of diabetes is very dynamic. They're always doing things, and, who knows? When in the 80s, they said the 80s, the decade for the cure. I was so excited. I'm like, oh yes, I'm going to get rid of this. Well, it ain't happened yet. So, with that being said, type 1, you need some type of insulin from an outside source, because your pancreas in your body, for some reason, is like, I'm not having it, and you gotta live, so you gotta have insulin, okay? Type 2 diabetes. Type 2 diabetes is very, I would pick it if I could pick one or two, because what happens with people with type 2 diabetes is that you're not making enough insulin, and oftentimes the reason behind that is because your diet, your genetics may cause you to eat more, and you gain weight, especially in your abdomen. So sometimes they tell you have a condition called metabolic syndrome, something that is connected to that causes type 2 diabetes. Or you may have issues with the fact that the medicines that you are taking may also raise blood sugar. Some medicines do that. And I'm going to talk about that when, the difference between diabetes, it's primarily affected by food, but also it can be affected by physical conditions, medicines, etc. So back to type 2, you're not making enough. Or the cells in your pancreas that release the insulin are not working as well as they could be. The benefit of people with type 2 diabetes is that with lifestyle change, diet, and exercise, you can live better than before you had diabetes. Studies have proven that if people followed the lifestyle of a person with diabetes, they would probably have a longer lifespan. And it's only because it's healthy food and it's good food and it's exercise and it's doing things that make you feel physically well without having to introduce anything other than what you already have in your body. You feel good when you walk. You know, you feel good when your body responds. If you pay close attention to it, your body responds to what you put in it. When you eat healthy foods, and I'm not talking about rabbit food and all this, that, and the other. You know what you can eat that you like that falls within the realm of being healthy. It's just you have to make the decision to do that. So I don't want to get defocused and start talking about the food component with type 2 diabetes, but it is a very, very important part. Because if you want to immediately, if you think you may have diabetes, and if you're feeling like you have diabetes and you haven't gone to the doctor yet, and you know, I hope I'm on your shoulder every day saying, go see about yourself. If you're thinking you might have it and you want to do something quick, stop drinking those sodas. You know, I'm not going to go into brands, but stop drinking those sugary sodas, those sugary, allegedly drinks that's supposed to be fruit drinks. So that's just straight sugar. You know, all those desserts and pies and cakes. And I know people that eat sweets for breakfast, lunch, and dinner. I mean, your life is worth more than a pastry. Your life is worth more than a brand of soda that people drink that they know can do a lot of different things, including, you know, clean car batteries. Okay? So, type 1, you don't make insulin. Type 2, you can make insulin. And guess what? There are pills that you could take if you have type 2. There's a pill that a lot of doctors prescribe, and this pill, a lot of people complain about it, and because they have diarrhea and they have gas, and that's just not a good look for nobody, and I get it. So I've worked with endocrinologists and specialists in the field of diabetes that always tell their patients, well, look, now that you want it, you need to take a fiber supplement. If you want this medicine, have a conversation with your doctor. What the medicine does, this one pill, what it does is when we're sleeping, our liver is squirting out sugar. It's like a protective device for the times when humans lived and didn't have access to food regularly. You know, the body is an amazing, wondrous thing. And that's something that's something that happens in the body. A lot of people don't know about that. So, you know, there are pills that can do that. There are pills that can make the cells or make the people who have type 2 diabetes, there are pills that will make those insulin cells release more until you can get yourself balanced. Okay? And it takes a minute. So when you get diagnosed with diabetes, don't overwhelm yourself and think, oh, Lord, it's the end of the world. My life is coming to an end. How am I going to do this for the rest of my life? You have to remember that it's temporary, okay? It's temporary because you just got the diagnosis. The gift in that is knowing that now you can have a plan. And believe me, within weeks, almost immediately, some of you are gonna be able to adjust. So it's okay to feel that initial panic and that initial sadness around getting a diagnosis. But the thing about diabetes is it's like training a little dog. You know, it's like training a Yeti. You found it in the woods. It was like, ah, and then, you know, you showed it a few things and now it'll die for you, you know. And I like that I make funny jokes and great comparisons. So anyway, so I hope that explains type 1 and type 2 to you. The thing about insulin is that, I'm going to give you an example of how insulin works. So as humans, we need fuel to function. Fuel is carbohydrates. Carbohydrates and sugars are the same thing. And I'm going to do one episode about to show you how to look at your labels and all that too. So we need fuel as humans. So when we eat food and drink drinks, whatever, the insulin, it's like going on a prom date. The insulin meets up with the sugar and they get together and they go into the cell, which is where the prom is being held. They go into the cell and they work in a body and do what they have to do. But when you have diabetes, I used to always use this comparison in class, and I know my students used to be like, this lady is corny, but I don't care. So for people with diabetes, the insulin is like the prom date that's staying you up. And so it's a bunch of chicks or a bunch of dates who've been stood up, and they getting together, and they mad, and they about to have a riot in your body. And so therein lies what happens if you, A, don't go see about yourself, okay? B, put off seeing about yourself when you know you have that. You know you have it. And I know I'm talking to somebody, and you know I'm talking to you. You need to go see about yourself. If you feel like the Lord made you look at my YouTube channel, maybe it could be it. Go see about yourself, okay? So anyway, I got a question, and it was like, so what do I take for diabetes? Okay, so there I go back to talking about what you could take. For type 1, we know we need insulin, okay? We gotta have it. Type 2, they have so many products for type 2 diabetes. Know this, that even the professionals like myself, it's difficult for us to keep up with it. Because diabetes affects so many different parts of the body. There are a lot of different medicines that help to treat it differently. So I talked about the pill that you take that might cause diarrhea, that a stomach upset, that you can tolerate if you take a fiber laxative, but you need to, not a fiber laxative. You don't need a laxative with that, but you need a fiber supplement. You can talk to your doctor about that and see if that works. Then there are other pills that make your blood sugar go down because they're making those cells squeeze out more insulin. You got to be careful on those because they work like insulin and they can lower your blood sugar. And I'm going to talk about that. There are other pills that make you urinate out the extra sugar that your body makes. The only problem is, and if this is for some of you all who have not gone to the doctor yet, if you're urinating and you having burning and itching, and it is not a sexual related situation, or if it occurs suddenly, then you need to make sure you go see about yourself, because organisms in the urinary tract love sugar. They're like, oh, Lord, we at the ice cream parlor. They love it. They're in Candyland. So see about yourself about that, okay? So there are other pills too. There are other things we call injectables, okay? Injectables are different medications that affect different parts of the body that can make your blood sugars more, as we say, balanced, because ain't nobody ever in control. The only one that I know that's in control, is that person. But we like to say balance because we already stressed out and trying to feel good about living with this disease. So the other products, one of them is you can take an injection, and what it does is it makes the body believe that it's full, and so you don't eat as much. Some of us like to eat. I live in New Orleans, Louisiana, the food mecca of the universe. I promise you, everything is good. Everyone can cook. It's ridiculous. So, and right now, it's Mardi Gras time. Man, look, it requires a lot of self-love and discipline, but you can still enjoy yourself. So I say that to say, some injectables trick your stomach into feeling like, oh, it's full, so you don't want as much. Other ones do other things that affect the other parts of the body. Also, with type 2, with type 2 diabetes, another way they may treat it is with insulin. If your blood sugars are really spiking and high and your doctor wants to handle it, let them handle it. Let them put you on insulin, even if it's just a month. Because the beauty of insulin is that it works. It works. It's easy to make. It's easy to get. And it works. And it should be affordable to everybody, everywhere. Because if people like me don't get insulin, we die. And in the United States, that's unacceptable. That's unacceptable. So I'm going to talk about that too. So anyway, back to type 1 and type 2. Type 1, I don't make insulin. Type 2, you still make insulin. You can make diet, lifestyle changes and literally reverse your condition and just have to monitor your intake and keep your doctor's appointment and live a life almost like you don't have diabetes. The only difference is that you eating and functioning in a way that's going to benefit you and your quality of life. And you're going to be around your people. You're going to be able to do the things you like doing, you know, and you will have a better quality of life. So a question I got, and thank you for your questions. There are no dumb questions. I try to answer them as best as I can. I got a question. What is diabetes? What can I take for it? Well, the energy I got from that question was like, I have a cold. What do I take for it? You need to, first off, there is no way that you will be able to successfully manage your diabetes until you see a healthcare professional at this point. And I am not even going to say anything differently because that's all that I know. That is the safest thing for you, because a medical professional will be able to look and see where you are in your life. Now, if you have other illnesses, what's your family history? What's your lifestyle like? Where do you live? What's the kind of food you eat where you live? I know a lot of you all live in Jamaica, you know. And I also understand that sometimes it's difficult to get to a doctor. So hopefully this video will give you some idea of what you can do until you can get there. So if you think you have diabetes, if you feel like you might have diabetes and you can't get to the doctor yet, immediately stop anything that will turn into sugar. You can't fool with that much of it. And that will provide immediate relief, but nothing is more important than going to your medical provider to see about yourself, okay? And with these segments are to help you get by until you can get help. Because with diabetes, you can't play around with it, but once you just deal with it and address it, you can flip that script so quickly. I mean, I wouldn't trade. I just think about if I could have other illnesses, what would I pick? Man, I wouldn't pick anything else but this. I get fed up and I get tired, but I got a great quality of life. I'm healthy with diabetes for 45 years. I'm healthy. I'm happy. And what I want you to know is you will be too, but it's up to you to do your part. So before I end this segment, the last thing I want to do is mention, I looked in some of my information. So I strongly recommend, if y'all are looking at me on YouTube, you probably can see this. You probably have computer access. If you go to the American Diabetes Association.org, the website is ada@diabetes.org. But just Google it because, you know, everything changes. People do so much late and update stuff. If you go to the American Diabetes Association, they have a wonderful compilation of interesting and informative and most positively easy to read and understand information to help you deal with diabetes. And so we know these people know what they're talking about. They're not a bootleg website that's giving some foolish information about, something that you drink and your diabetes is gone. And then the next thing you know, you're winding up in the hospital. You don't want that. So Google the American Diabetes Association. They have a lot of information, and they are my primary resource. One last thing I wanted to mention. I get a lot of magazines and periodicals. And today I got this clinical endocrinology news. And they were talking about people with type 2 diabetes. And they've done studies to show that the keto diet has shown to reverse the trajectory of the development and the progression of type 2 diabetes. Do I know the keto diet? No. But a lot of people do. I can look into it. But really, this is not for that. That's why I'm not giving you everything, because I want you to go to your provider and ask the questions about stuff that I'm mentioning. But I hope that it is helpful. So, like I said, this I really wanted to pound this segment out because I got so many requests, and a lot of people just are struggling to understand. But I'm here to provide insight. Please continue asking questions. Thank you for your time. I really appreciate you all allowing me to assist you on your journey. So until the next segment, be well.